Welcome, fellow Lions fans. Unfortunately, we did not run the table, and now Stafford might be hurt. So let's take a look at the video, see what might be going on with Matthew Stafford. Here's where he got crumpled up. So nice slow motion replay here. He injured his left abdomen or left side of his ribs. So keep an eye on the left side over there. He gets sort of crumpled up, rolled over. I don't see any direct trauma or blunt force to that area, which is good news. But he has sort of a twisting, torquing mechanism and gets hit from behind. My initial concern was another back injury like he's had the past couple years, but looks like he may have avoided that. So we'll keep running it, and he immediately reaches for the left front side of his abdomen. Now, keep an eye here as he's walking off after that play. Look at exactly where he touches. It's sort of a little bit below the ribcage area in the abdominal muscle area. So may not even be a rib issue, maybe an abdominal muscle issue. And if you keep watching, here's the very next play. He actually stays in for the next play. It's easy to forget that since he missed the rest of the game. But he played the next play. Keep an eye on him here. See how well he moves around. Moving around pretty well. Definitely keeping his left hand up there on his left abdominal area, but moving around pretty well considering. So not in any obvious excruciating pain on the very next play. We all know Stafford's a tough guy. He's going to try to play through anything. Well, he went into the locker room after this, probably got a Toradol shot and maybe an x-ray. Not sure if he had time to get an x-ray because he was back on the sideline pretty quickly, but probably got a Toradol shot to try to relieve the pain, to try to get back in the game. But it was the fourth quarter, about the 6-minute mark already, so not enough time really for that Toradol shot to take effect for him to get back into the game. Now, I think it's unlikely it's a rib fracture since he did not have any blunt trauma. One concern here with Stafford going forward is this is the third straight year that he's hurt himself with a crumple-type mechanism of injury. Remember, last year he got crumpled up from behind in the Oakland game, missed half the season, possibly had a transverse process fracture of his back, which is nothing serious but is a painful injury, can affect your throwing motion. 2 years ago, he may have also had a transverse process fracture. He played very poorly that year, probably the worst year of his career. He looked very limited out there, did not throw many deep passes that year. So there's a pain issue that really hurt his play a couple years ago. So 3 straight years now of a possible crumple-type mechanism, something to keep an eye on going forward. Stafford may need to reconsider how he runs the ball in the future to try to avoid these kind of crumple injuries, either slide in very horizontally or dive headfirst in a horizontal fashion so that he is not in a sitting position and getting hit from behind or from the side. Now, what are the prognosis here going forward? Here's the positive news. One is he played the next play, so it was nothing extremely acute and extremely debilitating right away. Also, he was standing on the sideline for the rest of the game. He was standing straight. He was standing upright, did not appear to be significantly limited. He did try to throw the ball a few times, obviously could not throw it properly or accurately or without too much discomfort, so he held himself out. But the fact that he was able to stand on the sideline without any obvious pain or limitation, no obvious constant pain there, is a good sign going forward. I think there's a decent chance he'll play this coming Sunday. Hopefully he can get in a limited practice either Wednesday or Thursday, which would be a real positive sign going into the weekend. It's probably unlikely he'll ever get up to a full practice this week because regardless of the severity of the injury, regardless of if he's going to play this coming Sunday, they're going to want to rest him and try to let that heal up as much as possible before the game. All right, another guy that got hurt during the game was Darryl Roberts, who's played really well for us in this 4th, 5th cornerback position. And he's been pressed into duty with Akuda and Desmond Trufant, both on IR. So here's in fast motion. You see that he immediately grabs for his right lower abdomen area. All right, and we'll take a look at the slow motion of that here. So what you see here is Alan Lazard's knee comes up and looks like there's blunt trauma to that right lower abdomen. So probably just a straightforward abdominal contusion, unlikely to be a muscle strain of any kind. I think there's a decent chance that he could play this coming Sunday. A contusion is generally not a big deal. It can be a pain issue, but shouldn't be any kind of long-term issue. Now, some injury news coming into the game was DeAndre Swift. He was fortunately activated. He played well during the game. There was some more information that came out late last week that maybe everything was related to headaches or possibly a migraine. Darrell Bevel had a quote in one of the media sessions that there's a fine line between a migraine and a concussion, and I totally agree with him. I would go farther and say that it's a big, cloudy, gray area. There's no way to tell if a headache is a migraine or a post-concussion issue. I guess there's a possibility, reportedly, that he didn't even have a concussion. So hard to say for sure what's going on. Migraines can be very, very difficult to diagnose and to treat. As an urgent care doctor, I deal with migraines all the time. It's a very frustrating issue for patients. There aren't any great treatment options. There's a lot of trial and error. A lot of different medications can be tried. None of them are great. None of them work great for a large percentage of people. So we'll keep an eye on this going forward as far as his headache issue. Other injury notes during the game, Amendola looked like he might have aggravated his hip in the second quarter, but he kept playing the rest of the game. Deshaun Han came in with an injury issue, but he played really well during the game, so that's good news going forward. All right, feel free to leave comments on YouTube or Twitter at Jimmy Liao MD. Thanks.